Dr. Song here from Omni Aesthetics. Today we are going to talk about botulinum toxin. This includes Botox, Dysport, and Xeomin. These three products are the only ones currently approved by the FDA for cosmetic use in the United States. Botulinum toxin reduces the appearance of wrinkles by weakening the muscles that we use to make certain expressions, like frowning. The most popular area treated with botulinum toxin are the number 11 lines caused by frowning. The crow's feet lines that appear when we smile can also be treated with botulinum toxin. Other areas that are considered off-label but are commonly treated by more experienced injectors are areas like the forehead and smoker's lines. Because botulinum toxin works on the muscles and not directly on the skin, the etched-in lines on your skin may not go away right away. But if you keep up with the treatments, over time, these lines should fade as well. Botulinum toxin is a naturally occurring protein produced by a bacteria. This is the same substance that causes botulism food poisoning. The reason that botulism is dangerous is because if you had a massive dose, like you would get with botulism food poisoning, it would affect all the muscles in your body, including the muscles you use to breathe. However, when we use it for cosmetic use, we are using such a tiny dose and we are precisely targeting the muscles that we do want to weaken, that realistically, you don't really have to worry about the life-threatening side effects. Unless, of course, you receive a counterfeit product or if you have a pre-existing neuromuscular condition that could predispose you to be more sensitive to the effects. So who should not be treated? Obviously, pregnant women or women who are nursing should not be treated with botulinum toxin. As I mentioned before, people with certain neuromuscular conditions should not receive botulinum toxin. And some of these disorders include conditions like ALS, myasthenia gravis, Eaton-Lambert disorder, multiple sclerosis, and Parkinson's disease. Also, if you have an active skin infection, or any kind of infection for that matter, you should not receive botulinum toxin until the infection is cleared up. Certain antibiotics, specifically a class of antibiotics called aminoglycosides, can exaggerate the effects of botulinum toxin, so you should not receive treatment while you are on any of these antibiotics or medications. Check with your doctor if you are taking any prescription medications. Treating certain off-label areas like the platysmal neck bands should only be performed by very experienced doctors because treating these areas inappropriately could lead to swallowing difficulties, which could lead to requiring a feeding tube. This is very rare, but this is a serious complication that could happen if the procedure is performed by inexperienced practitioners. Allergic reaction to the product is rare, but it's a possibility with any medication, and specifically if you have a known allergy to albumin, you should not take botulinum toxin. Now, if I haven't scared you off with talk about the rare but potentially dangerous complications, we'll talk a little bit about some of the more common and realistic things that you should be aware of. The most common adverse effect is bruising, and this is actually from the needle rather than from the botulinum toxin. So avoid taking aspirin, ibuprofen, alcohol, or any kind of blood thinner for about a week before your treatment if possible. But of course, don't stop your medication if you're taking it for a medical necessity. The other things that can happen is that if you receive too much product, or if you're very sensitive to the product, you could get a droop. And most commonly, the droop would occur in the brows. You could get a heavy brow, or sometimes the droop could be significant enough to affect your ability to see properly. So you need to get your injections from an experienced practitioner to avoid these kind of complications, which are temporary, but it's not a desirable outcome because certainly you want to look better, not worse, and also it could take months for a droop to resolve. The other things that could happen is you could get a headache, and some people get headaches every time they receive botulinum toxin, but my experience is that people may get a headache the first time, but then they don't get headaches the subsequent times. The other things that could happen, it's pretty rare, but sometimes you could get blurred vision or even double vision after receiving botulinum toxin. And this occurs if the product affects the muscles that move your eyes. So this is not going to cause permanent vision problems, but it could last weeks and sometimes months. But it will resolve, and again, it will not cause a permanent vision problem, but it is something we want to avoid. And we can avoid it by making sure that we're not using too much product and we're injecting it in the correct areas. But even with the most experienced injectors and with all the precautions, sometimes some of these complications can happen, and it is very rare if your doctor or practitioner really knows what they're doing and are experienced. If you do get some of these undesirable side effects, such as drooping or what we call spocking, is when your eyebrows go up and make you look like Mr. Spock, a lot of times these things can be fixed with a little tweaking. So do call us or call your physician if you do experience some of these effects. We try to avoid them to begin with, but it's good to know that sometimes these things can be fixed and quite easily. So the other things you should know is that it takes about a week for botulinum toxin effects to kick in. So after you receive your treatment, you may not see anything for a few days, and then you'll see the movements start to stop, and it will take a good week for it to completely kick in. The effects will last about 3 to 4 months. We could get it to last longer with more concentrated doses, but of course that's going to increase the cost and also increase the risk of adverse effects. So 3 to 4 months is a nice longevity for us to shoot for, and we don't really want to try to get it to last longer than that, because putting in too much product can cause some problems. So I hope this was informative. This is certainly not covering everything, but I think we've covered most of the things that you should know before you receive botulinum toxin. And by the way, we're only going through the potential risk with botulinum toxin so thoroughly because this is a cosmetic treatment and it's not really a medically necessary treatment. So we are much more careful with this than other medications. In fact, this is probably one of the safest medical treatments that you can receive. And it is actually safer than aspirin or Tylenol, because aspirin and Tylenol cause a lot of morbidity every year, certainly a lot more than botulinum toxin. So we hope that you enjoyed this talk, and we hope you found it informative, and we hope that you enjoy your botulinum toxin treatments, and I'm sure that you will love the results. And make sure you are getting your treatments from a licensed and experienced practitioner who is giving you the real product and not a counterfeit product. If you have any questions, we'd be happy to answer in person. Just give us a call and come in for a consultation if you have not done so already. This is Dr. William Song from Omni Aesthetics, and we thank you for listening.